Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been following the diet and medication plan we discussed last time, but I'm still finding it quite challenging to manage everything, especially my blood sugar levels. My diabetes has always been a bit hard to control, and even with the diet changes, it feels like a constant battle.
I understand it can be frustrating. Can you tell me a bit more about the specific challenges you've been facing with your diabetes management?
Sure, the main issue is balancing my meals and medication. Since we switched to glipizide, I've noticed some improvement, but my blood sugar still spikes, especially after meals. I've been trying to cut back on foods like bananas and oranges, as you recommended, to manage my potassium levels too, but it's been tough to find the right balance.
That sounds quite demanding. How about your blood pressure and kidney function? Have you noticed any changes or new symptoms there?
No new symptoms, really. I've been taking my blood pressure regularly at home, and it seems stable with the medications. The last lab results showed my kidney function was stable too, which is good news. But the diet restrictions for potassium are complicating my choices for managing diabetes.
It's good to hear your kidney function is stable, and managing multiple conditions can definitely complicate your diet. How about your gout? Any flare-ups or pain recently?
Luckily, no major flare-ups. I've been using the colchicine as needed, and that seems to keep it under control. I haven't had to take it much recently, which is a relief.
That's good to hear. Have you had any other health concerns lately? Anything at all that's been on your mind?
Well, with my family history of colon cancer and the sickle cell trait in my son, I do worry about genetic risks and whether I need to be more proactive with screenings or any other preventive measures.
That's a valid concern, and it's something we can continue to monitor closely. Now let's go over some of your recent clinical values to better understand your overall health condition. Looking at your lab results, your blood pressure is also well controlled. However, your fasting blood glucose and HbA1c levels are still higher than our target, which suggests we need to adjust your diabetes management. Your cholesterol levels are within acceptable limits, but we'll keep monitoring them. Uric acid levels are at 6.5 milligrams per deciliter, which is just on the higher edge of the normal range, potentially explaining the previous issues with gout, although currently under control with medication as needed. The C-reactive protein, CRP, level at 2.8 milligrams indicates a mild increase, which could suggest some inflammation, a common occurrence in chronic diseases. Liver function tests show your alanine transaminase, ALT, at 45 U/L and aspartate transaminase, AST, at 37 U/L, both of which are slightly elevated, suggesting we should keep an eye on liver health, particularly since liver ultrasound is part of your routine screening. Your thyroid-stimulating hormone TSH level is at 3.2 mmHg, which is within the normal range, indicating stable thyroid function. Lastly, your urine albumin to creatinine ratio is 30 mg/g, pointing to a manageable level of albuminuria, likely related to both diabetes and chronic kidney disease. This requires ongoing monitoring to assess any progression in kidney damage.
I see, that makes sense. So what would you suggest we do next?
I think it would be prudent to consider increasing your dosage of glipizide to twice daily. This should help manage your blood sugar levels more effectively. Additionally, I would recommend a dietary consultation to review your low-potassium diet and see how we can also optimize it for better diabetes control.
Okay, I'm willing to try that. What about my concerns regarding my family history of cancer?
Given your family history, it's important to stay proactive. We have scheduled a liver ultrasound, which is part of our regular screening. Additionally, let's schedule a colonoscopy as soon as possible to check for any issues there.
That sounds good. I'll make sure to follow up on that. What about the follow-ups?
We'll need to see you again in 3 months to review your blood sugar levels after adjusting the glipizide. We'll also check your potassium and other kidney function indicators then. Make sure to have the lab work done a week before our appointment. And remember, monitoring your health during activities like bicycling is important, especially as we adjust your diabetes medication.
Thank you, Doctor. I appreciate your help in managing all these moving parts. It's a lot, but I feel better having a clear plan moving forward.
You're welcome. Managing chronic conditions can be complex, but you're doing well. Keep up with your medications, diet, and regular checkups, and we'll tackle any issues as they arise.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. I wanted to discuss a few issues that have been bothering me lately. My upper arm pain, for one, it's been sharp and burning, especially when I try to stretch or pull something. It started about a month ago and hasn't improved.
I see. Can you tell me more about what activities seem to trigger this pain?
Well, mostly when I try lifting groceries or doing some yard work. I thought it was just a strain initially, but it hasn't gone away, and the pain can get quite intense.
Okay, we'll definitely look into that. How about your hearing? I noticed you mentioned some loss there as well.
Yes, that's correct. My daughter first pointed it out. She noticed I was asking her to repeat herself more often. It's mainly in my left ear. My father had significant hearing loss after his military service, so I'm worried it might be getting worse.
Understood. We'll make sure the audiology consult is scheduled soon. And how are you managing your diabetes and heart conditions?
I've been keeping up with my medications, metformin, glipizide, and the others. My last blood test showed good control, but I'm concerned about the cost of medications and transportation. I had to delay car repairs recently, which makes it hard to get around.
That sounds challenging. It's important to keep your mobility to maintain your physical activity as much as possible. How about your shoulder pain?
It's chronic. I've been managing with Tylenol as needed. It's not as severe as the arm pain, but it does limit me quite a bit. I can't do as much around the house or enjoy my gardening as I used to.
All right, we'll keep an eye on that as well. You mentioned an upcoming abdominal ultrasound.
Yes, there's some calcification in my aorta that they found during my last checkup. They want to make sure it's nothing serious.
Good. It's crucial we monitor that closely. Have you noticed any other new symptoms? Anything else that's on your mind?
Not really new symptoms, but I'm always worried about my health costs, like I mentioned. And sometimes I feel a bit isolated because of my transportation issues. It's tough to stay active and social.
I understand. It's good that you're maintaining social contacts and physical activity as best as you can. Let's review what we've discussed and outline the next steps. Based on what you've shared today, the plan will include the following steps. First, we'll address the upper arm pain. Given your description, it seems consistent with tendinitis, but we'll consider an X-ray or MRI if there's no improvement with initial treatment. We'll start with rest, ice, and possibly an anti-inflammatory medication. For your hearing loss, the audiology consult is crucial. We need to determine the extent and type of hearing loss and discuss possible interventions. We will continue to monitor your chronic conditions closely. Your diabetes and heart health appear stable from your recent labs. However, we'll review your medications today to ensure they are still the best fit considering your overall health and costs. Regarding the abdominal ultrasound, it's scheduled to assess the aortic calcification. It's important to rule out any significant issues there. Finally, I understand your concerns about transportation and costs. I can refer you to our social services team, who might help with resources for transportation and managing medication costs. To recap your vitals and labs from today, blood pressure is slightly elevated at 142/88 mm/Hg, which we'll keep monitoring. Heart rate, respiratory rate, and temperature are within normal ranges. Your weight management seems fine with a current weight of 198 pounds. Lab results indicate stable blood sugar and cholesterol levels, and your liver and kidney functions are good. I'll see you back here in 4 weeks to reevaluate unless something urgent comes up. Do you have any questions about this plan?
No, that sounds thorough, doctor. I appreciate your help sorting through all this. I'll make sure to follow up on all the appointments and tests.
Great. I'm here to help you manage these issues. We'll work together to keep you as healthy as possible. See you in a few weeks, and don't hesitate to call if you need anything before then.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Ever since starting the new medication, I've been experiencing some alarming side effects like dizziness and constant headaches.
I'm sorry to hear that. When did these symptoms begin?
They started roughly 2 weeks ago, soon after I began the new prescription.
Given what you're describing, it sounds like these could be side effects from the medication. Have these symptoms interfered with your daily routines?
Yes, significantly. I find myself needing to rest more often, which has impacted my work and personal life. It's quite frustrating.
Understandably so. It's important that we manage these side effects effectively. I recommend we conduct some follow-up tests to ensure there's nothing else contributing to your symptoms. We may also need to adjust the dosage or consider an alternative medication. In the meantime, I'll prescribe something to help manage the headaches and dizziness.
Now look at question 26.
We need to review the care plan for our patient who sustained multiple injuries from a recent car accident, including leg fractures and a concussion.
His mobility is compromised, which is impacting his mental state. He seems to be showing signs of depression, likely due to his loss of independence and ongoing pain.
That's an important aspect. Integrating mental health support with his physical rehabilitation could be beneficial. How can we best address this?
I recommend we start with psychological evaluations and possibly include therapy sessions to support his mental well-being. Physically, if we could initiate some form of gentle yet effective physical therapy, it might help him see some progress and uplift his spirits.
Excellent points. I'll arrange for a consultation with our psychological services and coordinate with physical therapy. We also need to ensure his pain is managed well throughout this process.
Now look at question 27.
The patient in bed 6 underwent a cholecystectomy earlier today. Post-operation, her vital signs have remained stable, although she has complained of significant nausea. We have her on IV fluids, and ondansetron has been administered to control the nausea. She is currently drowsy from the anesthesia, which is typical. Her incision site looks clean, with no signs of infection so far. She's scheduled for a pain assessment in 2 hours. Please continue to monitor her for any potential complications, such as increased pain, fever, or changes in her wound appearance, and make sure to document any new developments.
Now look at question 28.
Let's discuss our care strategy for Mr. Thompson, who is nearing the end of his life. His family has expressed concerns about ensuring he remains as comfortable as possible.
I've reviewed his medication regimen, and while it seems to manage his pain at times, he still has episodes of significant discomfort. We should consider optimizing his pain management protocol.
Agreed. I think increasing his baseline pain relief medication could help, along with regular nerve blocks. Additionally, ensuring he has access to spiritual care and psychological support will be vital for him and his family during this time.
Absolutely. I'll coordinate with our spiritual care team and ensure our counselors are available to support the family. Let's also keep the lines of communication open with his family to address any further concerns they might have.
Now look at question 29.
I'd like to hear more about the symptoms you've been experiencing and how they've been affecting you.
Well, the anxiety has been overwhelming at times. There are days when the thought of going outside is just too much, and I feel trapped in my own home.
That must be incredibly difficult. When you feel this way, have there been any strategies that have helped even a little?
Sometimes, practicing deep breathing helps, or I'll listen to calming music. It doesn't always work, though, especially on the bad days.
It's good to have some tools that sometimes help. Let's explore other strategies as well, such as cognitive behavioral therapy, CBT, which can be very effective for anxiety. We can also look into medication options if you're open to that. The goal is to find a combination of therapies that can give you more consistent relief.
Now look at question 30.
Today, we will focus on enhancing our hospital's response to domestic violence cases. It's crucial that we recognize both the physical and non-physical signs of abuse. Emotional abuse can be just as damaging as physical harm. Victims often feel unsafe and may be reluctant to speak openly. It's our responsibility to ensure that conversations occur in a private and secure setting to encourage disclosure in a safe manner. We should provide immediate medical care for any injuries, but also consider the psychological impact of abuse. Offering a referral to support services, including counseling and legal aid, is essential. Accurate and discrete documentation of all observations and statements is critical for future legal or therapeutic needs. Ultimately, our approach should not only address the immediate health concerns, but also empower victims by providing comprehensive support and resources to help them move beyond the abusive situation.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Hello and welcome to today's Healthcare Deep Dive, where we explore complex and intricate medical issues that challenge our modern healthcare systems. Today, we're discussing the intricate interplay between chronic disease management and social determinants of health, using a detailed case study to illustrate our points. Let's begin with the case of Maria, a 54-year-old woman diagnosed with type 2 diabetes and hypertension. Maria is a single mother living in a low-income urban neighborhood. Her case is particularly challenging due to several socio-economic factors that exacerbate her health conditions. Maria was referred to our clinic after a recent hospitalization due to a diabetic emergency. Her medical history is complicated by inconsistent access to healthcare, largely due to her financial situation and her job as a part-time cashier, which does not offer health insurance. Furthermore, Maria lives in a food desert, a neighborhood with limited access to affordable and nutritious food, which complicates her ability to manage her diabetes effectively. According to a study published in the Harvard Public Health Review, the social determinants of health, like income, employment, education, and access to nutritious food, significantly influence the management of chronic diseases. The study argues that addressing these determinants is crucial for effective disease management and prevention strategies. In Maria's case, our first step was to address her immediate healthcare needs by stabilizing her blood glucose levels and managing her hypertension. However, recognizing the importance of social determinants in her health, we also implemented a multidisciplinary approach. This involved collaboration with a social worker who assisted Maria in applying for Medicaid, which improved her access to consistent medical care and medication. Nutrition is a critical component in managing diabetes, so we also connected Maria with local community resources that offer access to affordable healthy foods. A partnership with a local food bank and enrollment in a community-supported agriculture (CSA) program ensured that she received regular supplies of fresh produce. Moreover, education plays a pivotal role in managing chronic conditions. We provided Maria with diabetes self-management education, tailored to her literacy level and cultural background, which is supported by research from Harvard School of Public Health that emphasizes the efficacy of culturally sensitive healthcare interventions. Chronic stress is another significant factor impacting Maria's health. Living in poverty, managing a chronic disease, and single parenthood are all stressors that can lead to poor health outcomes. To address this, we referred Maria to a mental health counselor specializing in chronic health conditions and stress management. This holistic approach not only addresses her physical needs, but also her psychological well-being. To further support Maria's health journey, we introduced her to a community health worker who speaks her language and understands her cultural background. This worker provides ongoing support, helping Maria navigate the healthcare system, reminding her of appointments, and reinforcing the education she receives at our clinic. Maria's case is just one example of how complex the management of chronic diseases can be, particularly when compounded by adverse social determinants of health. It underscores the need for healthcare systems to adopt more integrated and patient-centered approaches that consider these broader factors. Maria's ongoing journey illustrates the critical need for healthcare policies that facilitate comprehensive care models, integrating medical care with social support services. It's essential for healthcare professionals to advocate for changes that improve access to healthcare and address social determinants to reduce health disparities, particularly among vulnerable populations. Thank you for joining me today on this insightful exploration into chronic disease management and social determinants of health. We'll continue to delve into these complex healthcare issues in our future sessions, aiming to illuminate the pathways towards more equitable and effective health systems.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome everyone to today's session on endocrine disorders with a special focus on the complexities of hyperparathyroidism. I am Dr. James Aon, and I'll be guiding you through a detailed exploration of this condition, highlighting its pathophysiology, diagnostic approaches, and management strategies. To make this discussion as practical and insightful as possible, we will examine a case study involving a patient with primary hyperparathyroidism. Let's dive into the case study of Jane, a 47-year-old female who presented with nonspecific symptoms of fatigue, joint pain, and occasional constipation. Her routine laboratory tests revealed an elevated serum calcium level of 11.2 milligrams per deciliter, which is slightly above the normal range. Given the high serum calcium, further tests were performed, including a parathyroid hormone (PTH) assay, which also turned out to be elevated. This combination of hypercalcemia and elevated PTH suggested primary hyperparathyroidism. To understand the condition further, it's crucial to grasp the physiology of the parathyroid glands. These glands regulate calcium levels in the body through the secretion of PTH. In primary hyperparathyroidism, one or more of the parathyroid glands function abnormally, leading to the excessive production of the hormone and, consequently, high calcium levels in the blood. Returning to our case, Jane's next diagnostic step was an ultrasound of the neck, which showed a small adenoma on one of her parathyroid glands. This finding supported the diagnosis of primary hyperparathyroidism. It's important here to differentiate between primary and secondary causes. In secondary hyperparathyroidism, the gland's activity is a compensatory response to hypocalcemia, often due to vitamin D deficiency or chronic kidney disease. Management of primary hyperparathyroidism typically involves surgical intervention. In Jane's case, given her symptoms and potential complications like osteoporosis and kidney stones, surgery was recommended. The surgical removal of the adenoma is usually curative. Post-surgery, Jane's calcium and PTH levels normalized, and her symptoms significantly improved. However, the management of such patients doesn't end with surgery. Long-term follow-up is essential to monitor for recurrence and to manage any complications related to the disease or its treatment. From Jane's case, several key learning points emerge. First, the importance of recognizing the nonspecific symptoms that might hint at an underlying endocrine disorder. Second, the critical role of biochemical tests in the diagnosis of hyperparathyroidism. And third, the effectiveness of surgical treatment for primary hyperparathyroidism. Primary hyperparathyroidism is a complex endocrine disorder with varied presentations. A thorough understanding of its pathophysiology, timely diagnosis, and appropriate management are crucial for optimizing patient outcomes. Jane's case is a prime example of how interdisciplinary approaches can aid in the effective management of such disorders. Thank you all for joining today's session. I hope this discussion and the case study of Jane have provided you with deeper insights into the management of hyperparathyroidism. We look forward to seeing you in future talks where we continue to explore more about endocrine disorders and their impact on health.